So shall we wait a couple of minutes?
Yes, I think so.
Okay. What I'm going to do, so what we are planning to do is that I'm going to talk briefly about digital transformation nationally, regionally, locally, just focusing on the neurodisability side of things. That's both autism and physical disability. Then Lucy and Louise, we're going to talk briefly about what we're trying to do to understand the digital access in Peterborough for families with disabilities. And we've done some surveys and try to get some data and then have a little bit of discussion really. So it depends on how many families log in. I think Louis said a couple of families registered, but we can see what we can do. So while waiting for more people to join us, I will try and share my slides, see whether if I can share them. Oh, it looks like I might be able to. So shall we make a start then? Right, okay. As I said, I've been trying to move us along with our digital journey for a long time. And also have a lot of other interests which join up with that. One of them is I'm Officer for Digital Health and Technology for the Royal College of Pediatrics and Child Health. And also I have loads of conflicts of interest, but they're all related to this really. I'm a medical director and the lead for artificial intelligence for a few companies. One is called Future Perfect Healthcare, where we help different organizations pull the data together, then feed it into an artificial intelligence platform to make early diagnosis of genetic conditions, cancers, and neurodevelopmental problems. I'm working with an Israeli startup called Illyria, where we're trying to diagnose ADHD by measuring activity levels on smartwatches. And also there is a company I'm working with set up by an NHS pediatrician called Enrich My Care, where we're developing a platform for the parents where they can hold all the child's information, a child with a disability. So they can get information from GP, education, social care, different hospitals. And they got a lot of additional tools like diaries and medication management plan, upload the videos and share the data. And also we can use the data and use the artificial intelligence to tell them that what's the best way to manage pain or best way to help with the feeding and those kind of things. So all these things are related to what I do really. I've been trained by the NHS through the NHS Digital Academy to be a digital leader in the NHS. I finished my postgraduate diploma. I'm doing my MSc at the moment, and my dissertation topic for MSc is the using digital and AI to early recognition and diagnosis of autism in the preschool children. As part of that, that fits in with the research I'm doing with NHS England anyway about improving the pathways for children with autism. And that's a big 1 million project. We are 3/4 out of the way. We've done a review of all the published literature about autism pathways. And we surveyed 129 units that provide autism diagnosis to understand about the pathways. Those 2 papers already published. Now we're talking to, we selected 6 high-performing pathways, and you wouldn't be surprised that Peterborough is one of them. And now we are talking to parents, commissioners, professionals, children, about what is good about the pathway and what works well, how other people can learn from it. And we also will be reviewing a set of notes as well. And some of you might know about ADHD in Peterborough. I introduced something called a QB test, that is a quantitative behavior test to make a diagnosis of ADHD. In the past, we only made diagnosis of ADHD by just talking to parents and the schools and completing the questionnaires, which was all about secondhand, and it is to be subjective. what we introduced is a child sits in front of a computer, does a 20-minute computer game with a marker that measures how much they move. And at the end of 20 minutes, it tells us objectively what is the level of attention, hyperactivity, impulsivity as like a growth chart compared to boys or girls of similar age. That has been picked up nationally, and I'm helping it to be rolled out across east of England by jollying other people to adopt that, really, I think. And I already mentioned about my role with the Royal College. That's about helping NHS England, NHS Digital, NHS X, pediatricians, and anybody interested in to use the digital tools to improve the care and practice of pediatrics. And we also work very closely with children and families to help us to move forward. And I'll tell you a little bit about what we're working on at the moment on behalf of the Royal College of Pediatrics and the Child Health. So this all started well before the COVID, but as you can imagine, last 2 years, it has completely accelerated. And the physical manifestation of it is that if you come into Child Development Center today, Ali, you won't recognize it compared to what it used to be when you were there.
I was just thinking that. Look at the beautiful colorings.
Yeah,
drawings.
So that's actually so we got all those, the birds and the sceneries painted on either side of the entrance. That was done around Christmas time with a local artist, and money supplied through our Head to Toe charity. And we have got some ceiling tiles along the corridors and the treatment rooms, which I got a fantastic artificial sky with the pictures of ladybirds, even better than those rendering with the ladybirds and trees and clouds and those kind of things. And we got some augmented virtual reality headset for the parents and children to use to both for calming down as well as for the virtual reality treatment. And the projections are coming at the moment, and we'll be putting through some sensory stuff on the walls to make them make noises and those kind of things as well. So that's the kind of a simple use of digital tools to improve the service user experience within the Child Development Center. But as you can imagine, it impacted every bit of our service before the COVID. That is our lovely head of speech and language therapy, Annika, doing assessment with the preschool children in the clinic. And we used to do a pediatrician used to see the children, then they will be seen by psychologists, speech therapists, and occupational therapists. And then we used to give a feedback. All of that used to take 3, 4, 5 appointments. Then all the interventions used to be in person. But when the COVID hit, we couldn't do any of that. And we had only 2 choices: either stop doing it or find another way of doing it. And that's where the digital came into its own. Now we take history by telephone, and we used to do assessments by video, which can be done either live, our parents recording the child's social interaction, communication, uploading it. But now we've gone back to doing that bit in person because that's better. And same thing with the physical examination is done in better. And a lot of our interventions, this is about, so this has happened internationally, and almost everybody has looked at what can we do to do the autism assessments digitally. So a number of platforms, the number of tools have been brought in. Some of them are private, like Helios and the NODA. They cost a lot of money. But what we've done locally, use the simplest tools, which is available free for the NHS, like the telephone, and attended anyway video consultation platform, something called a BOSA instead of ADOS, because that we can do with the face masks and social distancing and those kind of things. But as we go forward, I'm working with a number of universities and private companies to find a better way of capturing the information from the families, sharing between all the providers, and parents able to upload their own information so that parents with the children with additional needs will control everything about the information. That information can be shared for EHCP, for anything you want without telling the story again and again, really, I think. So this is our, we used to have a 12-week program of interventions after the diagnosis of autism. To start with, it all used to be in person. We now turned it into quite a bit of that into combination of webinars, live video consultations, and in person. Now we mainly switched back to the webinars and in person because that's the better, because the one thing we found out very quickly is that not every family has the data and the devices and the skills to be able to do video consultations, record and upload. Lucy will talk a little bit about what we're doing towards that, really, I think. So this is about the QB test and the ADHD. Bottom right, you can see the child sitting in front of a computer and with the camera in front of it, and you log in and do a 20-minute test at the end of it to come out with a fantastic report, one for the parent, one for the professional, explaining how the child is doing compared to other children of similar age. And that's really, really useful. So there's a lot of things have changed, and Lucy and I have written it all up about all the changes we've done in Peterborough. It's published in a pediatric journal. We're quite well advanced compared to a lot of other places, and a lot of people learn from us and come to talk to us to pick it up and move forward. And this is the bit I talked about, the autism. That's about, this is so the national policy about guidance about autism pathways will be influenced by what we're going to be telling them. So I meet with NHS England every month at the moment, and I'm working with another professor from Manchester called Jonathan Green, who is leading on the intervention side. Together we'll be advising on the NHS England about what a good autism pathway looks like, what intervention package should be, and that will feed into our local all-age autism group and board we had recently. We done the strategy, we done the consultation, and there is a consultation carrying on with the roundtable with a company called Taproot, which is trying to find out what we should be doing locally, and that will lead to action plan for mental health and neurodiversity, and this will all feed into that. But we're already well ahead of what will be coming out because we're already implementing all these kind of things, really. So nationally, I'm working with the Royal College to look at a number of things that will help this digitization process. Medicine for Children is an app that explains to families with additional needs about how to give different medications in complex children, all the way from oral medication to gastrostomy to very complex medications with the videos and explanations. We are building on that. I can share the links through the Family Voice Peterborough. You know, the red book we have with the 0 to 5, where we used to write it on paper. We are turning that into an electronic app at the moment. That's we are 3/4 way through that. And also we're extending that to until 25 for the families with additional children with additional needs. So that what I mentioned before, which we're doing in a private enterprise, that's also happening through the NHS England, NHS Digital, NHSX, and the Royal College of Pediatrics and the Child Health. We turned the growth charts into electronic growth charts now with what they call API. That's the application program interface. So any of that can be plugged into any electronic health record. For example, System 1 or EPIC in Cambridge, they can have this application, and you don't need paper growth charts, and you can put it in, it automatically calculates all the centiles and everything that's integrated into electronic health record. So that's all happening really at the moment. So that's all I wanted to just say, that what's happening locally, regionally, and nationally. But the way going forward is going to be doing as much as possible digitally so that we avoid unnecessary transport, unnecessary needing to come in again and again for families who struggle with travel and putting children into taxis and buses and those kind of things. But this is not a substitute for face-to-face. It's about where can we add value with the digital, make it safer where it is possible, where it's better, But wherever we need to be seeing children in person, we will be continuing to do that. It's blending that according to what works best for each family, really. Clearly, we can't do any of this without parents and the children having access to good quality, whatever laptop and phones and data plans, and able to have the skills to use them. And that's where we're beginning to think about to understanding the needs of the children with the families. Lucy, you want to take over from here? Talk a little bit about what we tried and yeah.
Yeah, so obviously, hi everyone. So for those who haven't met me, I'm Lucy Brumpton, Team Manager for Community Paediatrics, and just for the minute stepping in for Service Manager while we've got an advert out. So it's lovely to meet everyone today if you've not met me before. So things that we're very mindful of are how long it takes for families to come to appointments, and is there ways of making things more seamless. So having kind of a one-stop shop for children with physical disabilities, where they might be able to meet OT, physio, SALT and community paediatrics at one appointment, where those professionals can link in and out. And we're also looking at how to use digital technology to in-reach, say, through to Addenbrooke's, where they might have a respiratory consultant that might want to speak to you, and they can come up on a big screen rather than you having to travel down to Cambridge. When I know from feedback from families that, you know, that's 30 minutes clamping a wheelchair in, if not longer, then that's the distance taken down to get down to Cambridge, and then the child coming out, and actually the level of fatigue experienced by children and families having to go to an hour an appointment, which is actually probably more 5 to 6 hours, which is a whole day. So we really are looking at how we can link in with those more sort of tertiary services, so Addenbrooke's, to make care a little bit more seamless. Other things we're looking at are how we capture young people's feedback within the service. So we Head to Toe have given us some shiny new tablets, and we're looking at how we can start to capture your children's views and opinions on how their appointments have gone. And using different emojis, we might be able to capture it through that. You've seen some of the smiley face options that are optional at the hospital. It's trying to make things not onerous for children because they won't want to complete them, and fun, but also appropriate for different communication needs. From a digital accessibility perspective, a lot of feedback from families who went through the assessment process when we were in the height of COVID. Oh, hello. Somebody's wanting to come in.
Yeah.
Was that actually, with all the data plans in the world, some of the systems are really complex to get onto appointments. So we've been in conversation with our volunteer sector to have a look at whether or not we can get a digital volunteer to support new families or families accessing digital platforms for the first time, which is really exciting. And then we sent out, recently Louise and I sent out a questionnaire which was trying to capture what is it about the world of digital appointments that people are finding hard and families are finding hard to get onto, or what is it you don't particularly like. And then from that, we hope to be able to tailor services going forward. And there was also an option there of going into a pool to be pulled out of a hat for preloaded SIM cards with data on, because that was another area that we knew families were struggling with. So it's trying to find a blended approach. Digital appointments aren't for everyone, and we need to respect that. So what we need to look at is how do we support families to feel that what they're getting meets the needs of the children and the families going forward. So that's kind of where we're up to. And also looking at volunteers coming to join our service to make those phone calls for patient feedback. Quite often you'll get a QR code, won't you, at the end of an appointment, or you might get a link sent through, but actually sometimes just talking about how your day's gone, how your appointment's gone, is probably going to capture more information than any form can ever capture. And it's how we utilise volunteers to support us to do that going forward. that kind of gives you a bit of an uptake of where we are.
Want to tell us a little bit of a successful application to the charity, the Vodafone or EE, the one we got here?
Yeah, so Vodafone have gifted, I suppose is the best way to describe it. There was a campaign that went out from Vodafone. We applied, well, Louise applied, and we have been gifted, I think it's about 100 SIM cards. So they're the ones that if you completed the digital questionnaire, you were also given a link to complete a second section, which allowed your name to go into a hat to then go into the pool of people to be awarded one of these free SIM cards. And I think it's over a 6-month period. Data is added over the 6 months to allow families to access those services going forwards who require appointments to be via digital. So yeah, that hasn't finished because we're waiting for the postal entries to come back in. So that's not closed yet. So we sent them out via email. They will have gone on Facebook, they'll have gone on social media. And then we had a proportion of families who don't have an email address with Community Paediatrics. So we also sent out a mail shot with a self-addressed envelope for families to send those back. So really looking at, it's only digitalization is only as good as if people have got the apps and the technology and the equipment to do it. So what we also wanted to capture was, what are we missing? What have families not got at home that they would benefit from? Or could we think of a space with, Louise and I have been discussing, could we think of a space within Family Voice or children's centres where families could go and have appointments on computers and log in? So that, that would give an option of going and having an appointment virtually if they haven't got the technology to do that at home. So yeah.
And I think adult services and adult mental health services, Alison might know a little bit more than I do. They employed some digital navigators and digital supporters and digital champions, and we want to extend that to children and the parents with disabilities as well, with access to digital hubs in the community for families who can't. And also we know that with the COVID, it's not just about health services. You can't access without digital access. It's including emergency support through COVID and educational services and the benefits and the social care. And we knew the education during the lockdown period. So unfortunately now, if families don't have access to the right devices and the data and don't have the skills to access it, they're already disadvantaged, and that disadvantage will be amplified and multiplied if we don't proactively address it, really, I think. And that's something we very, very keen to do that. And as we go forward, set up any digital pathways, they will be co-designed with the families, with user experience as the key, and it's families telling us how they want to access when and what, rather than we imposing on them, really.
Absolutely. So we've got some, so on the website, there will be a virtual tour that's going on, and if you've ever seen anything labelled a social story, it will give you an idea of what to expect when coming into the Child Development Centre, with pictures for children to see before they come in. So if you're wanting to sort of reduce anxiety levels, it will be a collection of pictures and text, so you can talk through with your children and for yourself where to park, where the main entrance is, what CDC looks like now, because it looks very different to it did before COVID. There's been some fantastic changes with what Venkat showed you with the artwork, with the ceiling tiles, but there's also not hundreds of toys everywhere like there would have been previously because of COVID. And it's not as busy as it was, which for some children they'll appreciate, but for others it will feel very different. So when we spoke about the projectors, we've got an interactive projector which children will be able to play with while they're waiting for appointments when our reception area opens back up, which will allow us to just wipe a table clean. So actually we're still looking at how we can make clinical areas fun, because we want children to feel relaxed before they go into their appointment, but also meeting the needs of what we have to with an infection control.
I'll answer the simple question on the chat, then I'll ask Ali to ask a question. The CDC is the Child Development Centre, which is located in the Peterborough City Care Centre on Top Road. Ali.
Naughty may be using acronyms. Sorry, everybody. Yeah, Child Development Centre.
Yeah, just to say, Venkat, I'm just madly looking through all of our Teams folders to try and find the information, but you can never find anything when you're looking in a hurry, can you? But I'm absolutely sure that Nick Greaves, who's one of our mental health commissioning managers, and Amy, who I can put you in touch with, are doing some work on digital access within the CCG.
Yeah.
So I'm not sure if you're already linked in with them, but if you're not, I can certainly send them in your direction to talk to you about some of the work that they're doing, because it seems silly to double up, doesn't it?
Very much so. I think please email them, copy me and Lucy, and make sure that we're not duplicating any work that is going on, and we will continue to. It's a matter of working with what's going on through the commissioning sector, so that we work with it rather than against it, really.
Mm-hmm. Just one other thing while I've got the floor. I'm guessing that you've seen an impact on your DNA levels, your did not attend level. Sorry, acronym again.
It's interestingly enough, it's other way around actually.
Okay.
we actually have a less. Nowadays we call it WNB, as you know, Alice was not brought.
Was not brought.
That's
absolutely more appropriate, isn't it, for children? Yeah, of course.
So there was definitely, initially there was a dip because families were used to getting physical paper for the appointments, and some of the emails went to spam folders and people don't look at the emails. Once that is gotten over, and we now, as part of early help assessment, our initial one, we make sure that we double check and make sure that families have email address, which email address they prefer, and the mobile phones. And also remember, we introduced automatic text message reminders before the appointments. During the COVID changes, that dropped off. Suddenly we realized increase in the WNB, and we went back and did a audit of WNBs who was not brought to the appointments, and spoke to some families, realized what need to be changed. That's about reinstating, making sure that automatic text reminders go, and we double check the phone numbers and email addresses, and that's now back up to what it used to be, really, even better, I think.
Probably what's helped as well is that families get the COVID phone call 24 hours before. So, you know, there's more probably safety nets in place than there was before. But yeah, I think the first wave just saw families not only getting email correspondence from health, but I know that their email correspondence from schools rocketed. Everything was sent through, homework, messages, COVID updates. So I think families were really flooded with information. I don't think that overly has stopped, because I think they're getting flooded, but I think families' resilience yet again shines through on their ability to manage that influx of information. But I do know that the biggest concern for me is, if we've moved into such a digital world, that requires new skills for families to log information, to save their letters, and different platforms. There's a lot of, you know, it's not a piece of paper that's come through the door that you can stick on the fridge or you can put on a calendar. It's coming through. Some of them you have to log in to get your appointments. Some of them come through on an email. So I think it's been really respectful of that and trying to think with families what would make a difference. Is that a text reminder? Is it some way of capturing it, you know, working through it together to find out what best meets the needs of families? Because that's one thing I'm really mindful of, is just the impact collectively from services. And
also, most important is that any well-intentioned initiatives or changes can lead to unanticipated and unintended consequences. For example, when we're organizing telephone consultations, if we dial from our child development center, it comes out as a number withheld, and some families weren't picking up the phone because it was a withheld number. So there's a lot of ways of learning and asking from families about, you know, what works for you, really, I think. Any other questions? I think the last time we had about 20 families, I think. So it's a busy time, isn't it? Everybody getting back to schools. And
Can I have a copy of your presentation, please, Venkat, to share? Are you happy for me to share
yes.
with the team?
Yep.
Brilliant. Thank you.
I will definitely do that. I'll send you our published paper about digital transformation in Peterborough. But Lucy and myself, we wrote it up as well. Yes,
I really look forward to reading that. Yeah.
Yes.
Did you have a question?
All I can say is I wish this was in place 10 years ago when my little boy was 5. That's all I ask,
No, I would still relish hearing what impact it would have made for you.
Yes. Yeah.
Because I still think your perception and your viewpoint of not having that is different because you've lived through it. Because so you would almost can reflect on it a lot differently. And I would relish anything that you want to send through to Louise and she can forward on. I would greatly appreciate hearing that, because people only know what they know, don't they? And if we don't ask the right questions, you can't develop any further. And what we think is, oh, families will love that. No, they might absolutely hate it because we're not living with it. So yeah, everything is done on what families say.
Well, if you want anything from me, that's fine. I can, because it wasn't Peterborough, it wasn't Cambridgeshire. I started. Our diagnosis was down in Surrey. So, but there's a lot of stories I could tell you.
Yes.
And I feel so much for people nowadays that are trying to get healthcare plans and that for their children, because it was bad enough then, and I can only imagine what it's like when I hear things from people now.
Yes.
It was just a constant battle. You've got the paediatrician and the GP arguing things out, who's going to see them, who isn't, while we're sitting here with a child that's so lost and can't explain, how his world is and why he's doing these things that, the one thing that I can take from this that people hopefully don't do now is when I went to pick him up from school, primary school, and they said, oh, I think there's something wrong, or he could be a naughty child. Saying that to someone whose first child is 4 or 5 years old, but they couldn't give me any information, and I didn't know nothing then about autism. Now, thankfully, I've been on courses and all sorts of workshops, different charities down in Surrey, where they've had, they had a guy, his name was Dean, I can't remember his surname, sorry, I'd have to think about it, who had got autism, and he's a speaker now, and he's taking, and all the things. Then, if people could know that now, hopefully it'd make their journey easier.
Yes.
Than what we've been through in the last 10 years with my son, and I'm still going through now to try and get him what he needs, and to see the people, the professionals. I was lucky. I moved into a school where they were helpful. They helped pay for the OT, and that just brought him on loads until he could get all the rest of the help that he needed. But he definitely didn't get what he should have had, really.
That came out quite clearly in the survey we did of 129 services who replied all across the country. And the theme that came across consistently is what you're saying, that the awareness of neurodiversity, that's autism, ADHD, learning disability, dyslexia, dyspraxia, has improved greatly.
Yeah.
But referrals have improved greatly, but the resources to make the diagnosis and provide interventions across education, health, and social care have not at all. Every service we surveyed said that there have been doubling of referrals for autism diagnosis every 5 years, starting about 20 years ago. And every service has the same amount of resources. That's number of pediatricians, speech therapists, occupational psychologists, as 20 years ago, or if anything, it has gone down. And they're all traveling around and the waiting list, I mean, you know, I mean, I don't want to name names, but it's not uncommon for 2 to 3 waiting list for the first appointment, really. I think we know we're that bad, but COVID has put us back a little bit. We want to catch up, really, I think.
It took me from,
sorry.
It took me from just 4 years old to he was nearly 8 before we got diagnosis.
Yes.
So, you know, that was a very traumatic, and just not knowing what to do, and if there was any way you could sort of, you know, get that moving quicker and stuff like that.
No, the focus now is all going to be needs-based pre-diagnosis support, and don't wait for the diagnosis before we provide anything. That's going to be the key, really. I think speech and language or sensory or sleep or the behavior that need to be put in, or the needs are identified, rather than waiting for 3 years for the diagnosis. That's going to be the key. Most of my focus is going to be a lot on the preschool. So the more we catch before they get to 3 or 4, and use that very early stage of brain plasticity and get in support, then we can change the course of secondary problems and the brain development, like we can do with other children without autism as well. So got one more hand up.
And I'm not sure, I think my son has done your test, your ADHD, because he was tested for it about just over a year ago.
Yes.
And I think he actually went in and
went through the Kiwi test.
And
yes.
He hasn't got ADHD, not to the level, but
it's always useful, and also sometimes it's very difficult to differentiate between ADHD, autism, and learning disability dyspraxia. That gives you a very objective view of how bad it is, really, I think.
Yeah. Thanks.
Yes, please.
Hi, can you hear me?
Yes.
Yeah, so I'm Caroline Dedman, and I'm the co-production service user lead for the Healthy Child programme for Cambridgeshire and Peterborough. And I just kind of wanted to just chip in with regards to service user feedback and how powerful it is. So, you know, Trudy, your story, if you like, is can really kind of enhance the future. And if professionals and clinical needs and professionals can listen to your story and your experience, because you are the expert, then actually we can learn so much from you, and we can go forwards a lot easier. So it's really important that we do listen to our service users.
Yes.
Well, you know, I'm willing to, if you've got questions you want to ask me about things, you know,
Caroline,
you've got my email, everything.
Caroline, I will be coming to you because, as I mentioned, as part of my MSc, I only had a limited amount of time. So I'm actually talking to only professionals to find out, our health visitors, about what is it that's stopping them from recognizing autism early. I know some of the answers, but sometimes you have to hear it from the horse's mouth, really. But I also wanted to do the same from the parents, but I don't have time to fit in with the MSc. But once that is out of the way, I want to go out and speak to all the families who are going through the early health assessment process or waiting for MDT, to find out with them remember, we got some funding to test out some innovations for autism, and one of the things we're testing out is something called pediatric autism communication therapy, developed by Manchester, which is a very evidence-based training parents to support the child's communication rather than pulling them into those kind of things. And the things we want to pilot is there are some app-based solutions where parents can actually look at the video clips of children's communication before answering questions about the risk of autism, which then tells is it a high risk or a low risk. And we're training health visitors. Now we know that in the past we thought that before age of 3 we couldn't diagnose or recognize autism. Now we know that we can go down to as much as recognizing at 18 months and diagnosing at 2 years. So we want to start thinking about it at the 1-year developmental check, not at the 2.5-year developmental check. And then if we can come in, recognize early, and actually give parents that social communication therapy without worrying about the diagnosis, then we can get in much, much earlier and change the trajectory during the first 1,000 days, really. I think working very closely with Debbie Marshall and our team in Peterborough as a pilot, but we'll try to roll it across Cambridgeshire as well.
Yeah, brilliant.
So we haven't got any more questions, any more hands up. So we got 45 minutes down. So if we haven't got anything else, we will close this session and we'll continue to have these dialogues. But we're definitely going to be doing a lot of user experience based service redesign rather than a professional led service redesign as we go forward, really, I think. Thank you very much, everyone. Thank you.
Have any questions that are coming? You know, if you log off and think, oh, we should ask that, then please just try and get it through to us. I'm more than happy to respond off the call if there's something, or even if you didn't feel that you wanted to ask something on the call, then you can come through. I'm sure Louise will send it through to us. Or Family Voice Peterborough will send it through. Trudy?
Yeah. Could you send me in the chat your email address so I can then, come back to you and if you need anything from me, as in what I've been through, then I'm always happy to talk to.
Thank you. That's
anybody.
really helpful. Yeah, I'll get it over to you. I'll try and get you our admin one over, and then at least somebody will pick it up. Because what I'm always mindful of is I like families to get responses. And if I'm out of office or I'm out somewhere, I'd rather families get a response than feel that we've not listened to what they're saying. Okay. So I'll make sure I get a good one over to you.
Okay, then. Thanks a lot.
We meet with Louise from Family Voice every month, and she kind of brings anything that, and we also meet with the subgroups, like we have a BAME subgroup and hard to, I mean, we never use the word hard to reach families. We use our services are hard to access, not that families are hard to reach, really. And that's the language we use, and that we meet with those families. And we actually set up meetings with imams and the mosques to talk about disabilities among the families. That's unfortunately, some of them have to be put on hold because COVID, but we will restart them. And our Sharon Daniels, our specialist nurse for children with complex disability, she made contact with some imams and talking about end-of-life care in families of Muslim faith, and also encourage them to access end-of-life care through the East Anglia Children's Hospital. I think that we've been pushing for them to have a local branch in Peterborough. I think that consultation has started as well, because Peterborough families miss out with support for each residential support because it's in Cambridge as well, really. I think.
Yeah, but Trudy, if you are wanting to reflect on how life would have been different now compared to when you started your journey as a family, then I will absolutely reach out and we can meet and have a conversation around that. That'd be really lovely.
Yeah. A lot of what you've both said is, it does. I can sit here nodding and going, yeah. Do you know what I mean? Because I know.
It's that relatability for other families. Yes. So it's about saying this was our journey as a family, and if we'd have had this and this, that might have made our journey better. So it will encourage other families to reach out and access those offers that are there in those formats. So I will go to grab Louise at some point, or anybody from Family Voice. If they've got your email, then I will drop you a line and we'll arrange to meet. Absolutely, sounds brilliant.
And Trudy, okay. I worked in Surrey in neurodevelopmental services around the time that you're talking about, and certainly there wasn't the pathways that we have in Peterborough then, and even now I think Peterborough and Venkat's team is still very unusual in terms of how robust that pathway is, really. So I can imagine, sadly, what you went through in Surrey, because I was very much part of that at the time, and it was messy, to say the least, really. Yeah,
definitely. And the amount of people that I've been in contact with through the years, that when the school maybe or somebody says to them, oh, we think your child might have extra needs, and people are like, no. I hope that changes in years to come, because, you know, I've met people that won't sort of like say, no, I'm not going to get them tested or anything. That, you know, they'll grow out of it and whatever. And and, you know, and that's that early start, isn't it? Like you say, it's where it all really needs to begin. Sometimes it also depends, as you know, how that information is presented as well to the family. Yeah, and I think, you know, it sounds as though you know, it wasn't shared with you in a particularly kind or helpful or, you know, compassionate way. So, you know, that's not a good start, is it? It's not a good start.
Excellent. Thank you very much. I look forward to having regular meetings with all of you. Bye for now.
Thank you all. Thank you.
Thank you. Bye.
Bye, guys. Thanks ever so much.